the good points would have been, well, at least we've got these people here, but are we going to get any results, positive results from this? Because you don't always, promises are made, but promises don't always be kept.
Whenever you went into the room, what you were going to say, it was filtered away by the time you left and you were none the wiser.
They were speaking, as I said before, in a language that I didn't understand, so I need to know in layman's language what they're talking about, not in fancy words that I personally can't understand.
Since 2007, the PPR project has worked with groups to develop human rights indicators and benchmarks to measure whether their rights are being made real by government in a way that is evident on the ground. People affected by everyday things like pigeon waste on the landings of flats and broken glass in play areas have set indicators to measure change. They have learned that these everyday issues are also human rights issues. So while the groups measured whether pigeon waste was cleaned and broken glass was removed, they were also measuring the extent to which government agencies were doing what they were required to under human rights law. However, the groups realised that in order to make changes on the ground last, the way that services are delivered to communities had to change. People who were affected had to be involved in all aspects of decision-making processes that impacted on their lives.
We have to work together in partnership, and that takes communities, community groups, voluntary organisations, statutory organisations.
People who presented to Causeway out of ours with deliberate self-harm, we weren't able to follow them.
In February 2009, the Belfast Mental Health Rights Group secured a seat on the implementation board for the Card Before You Leave appointment system for mental health patients, a new policy change they had campaigned for. Many members of the groups had been involved in consultation or participation boards and other structures that they felt had not achieved anything. Using these experiences and the human rights standards around participation, the groups developed a set of participation indicators to measure whether their participation was being properly facilitated in line with human rights standards. In other words, was it meaningful? In practical terms, this meant, for example, ensuring information was presented in an accessible format and that groups were involved in setting the board's terms of reference. These were small steps that the group felt would help to measure whether participation was actually shaping decisions.
They were key to the implementation of Card Before You Leave, and I think you heard from some of the presentations this morning across the region that people welcomed that. They welcomed user and carer involvement.
I think it's your willingness to tell it as it is, actually, just to not to pull any punches with us, just to tell us honestly and pretty doggedly, I would say as well, how things are.
And they had clearly articulated the need. They had clearly articulated the deficit that they saw as far as health and social care services were concerned.
Things tend to just drift along, and I certainly don't believe the Card Before You Leave scheme would have happened without the pressure.
It actually gave me a much stronger appreciation of what the problem was, and I think other groups therefore as a consequence have benefited.
You've been very good at kind of bringing us back to basics and pointing out to us that there are certain things that you need, for example the submission of papers ahead of meetings so that you get an opportunity to read them and perhaps discuss them in fora like this, which actually brings you up to speed with us. Otherwise there would be a wee bit of an imbalance there, so you've been very good in that regard.
Challenges remain for the Belfast Mental Health Rights Group and their work to implement the Card Before You Leave. The system needs to be monitored to make sure that those in need of mental health treatment remain tied into services when they are at their most vulnerable. The Belfast Mental Health Rights Group are clear that their active and meaningful participation in this monitoring is key to making sure this happens.